Hello, everyone, and don't touch that dial. You might think it's New Year's Eve because we're all trying to wear a little bit of glitter, except, our special guest. And yeah, you got glitter there. That's wonderful, Lippy Butterfly. It is glitter for lipedema, and we will talk about that in a moment. We are welcoming all of you as you log on tonight with so much love. This is our last Lipedema Patient Roundtable of 2024, and what a momentous year. We can talk about some of the highlights, but one of the highlights was hearing from you what kind of guests you wanted on this program. And we delivered tonight because you said you wanted a vein expert on the show. And we have one of the best that there is in the nation, but he's not just a vein expert. He is also called, his brand is the Vein Doctor with a Heart. And he definitely has a heart for lipedema patients. He has proven that over and over again. And I love what his bio on LinkedIn says. It says, cardiovascular surgeon, educator, author, inventor, artist, poet, podcaster, entrepreneur, Dr. John Chubak. It's so wonderful to have you with us tonight.
Thank you so much. It's a pleasure to be here. Thank you for inviting me.
Oh, it's such a joy. And so, any of your questions about veins, we know you've got them, stick them in the Q&A. And in the meantime, let's do a little roundabout and talk about the glitter we're wearing and what it's all about. So let's start with you, Pattie, because you're the one that inspired us to all wear glitter tonight.
Well, it's actually Nikki from Lipedema Friends International who started this last year as a way to spread awareness for lipedema and, to shine a light on it, to sparkle, to feel like we can be something more than just lipedema. We can sparkle, we can shine. And Nikki Gregory is lovely. And yeah, it's her event and it's gone nationwide. And this is our second year. And it's a wonderful kind of, we do the big thing in June and it's kind of gets heavy in June. We're always sharing our stories and talking about our experiences so people understand what it's like. But December is more about fun and uplifting and yeah.
Yeah, it feels very sparkly. So tell us about your glitter.
Oh, so I made my glasses, a little rhinestone action. Miss Jewel, who helped me to bling some stuff. We were trying to bling our canes. That never happened, but I blinged my Peloton shoes and they look awesome.
Awesome. Love it. Well, you are representing, as always, Lipedema Fitness. We're so glad you're on the panel. Jenny Bogine, tell us about your glitter.
Well, I think it's pretty obvious. Got the little holiday rainbow ears. I had the raspberry beret from last year, but I lent it to somebody at Halloween that was all sequins. So we've got that. And this actually has, my top has a little bling to it. So.
Lipedema and Food Sensitivities is the organization, the group that you represent, and we love having you a part of the conversation. Siouxie Boshoff.
Hi.
Hi, tell us about your glitter.
Well, I mean, I love anything that involves celebrating the best parts of it and the hopeful future and the brightness of what's to come. So,
perfect.
This is my New Year's dress. I'm still somewhat packed wardrobe wise. So
no, and listen, this is a blouse that I've had for 20 years and I've never worn it. I've always wanted to. So I'm wearing it for all of you tonight. I said, gee, I wish I had a date, but you're my date tonight. So yay, I'm celebrating that. Angelique Charles, Lippy Butterfly, show us your glitter.
My little bling. It's about my attitude, but truthfully, this is just a shirt that I forgot I had in my closet.
Well, it works. We're so glad to see you. You have some things that you've been trying that you're experiencing some success with, so that's wonderful. And the pièce de la résistance, she said, I only have one glitter thing in my wardrobe, and I wore it in my engagement photo recently. And we said, well, then wear it. I mean, you shouldn't just wear it once. So tell us about your dress, PGP.
So I bought this dress 2 years ago through a thrift store for $33. It was Eloquy brand, tag still on, original price over $300. And I was like, I never dress up. I probably won't have anywhere to wear this. But the purple, I was like, I had to get it. And so it's been in my closet for 2 years. And then we decided to do like half of our engagement photos kind of like paparazzi style with like the flash and everything. And I was like, so we're gonna dress up. And he went right along with it. And I am glad I finally got to wear the dress.
We're glad you got to wear it. The photos are beautiful. You are stunningly beautiful. And I think what's even more beautiful is the happiness we see on your face. And I just want to shout out those of you that have logged on. We've got everyone from Lori Paquette to Amanda Hadaway and our friend Nita Cluis, Mary Herzog, Alexis McKay, Lisa Lugo, Casey Grosvenor, and so many more. I can't mention all of you, but some of you I know are blinging out even at home with us. So we love that you've joined us tonight. Do put your questions in the Q&A. And I'm going to start with you, Dr. Chubak. So tell me about how you developed a heart for the lipedema patient population.
Well, it's an interesting story. My background is in heart surgery. You know, I'm an open heart surgeon, and the first several years, 5 or 6 years I was in practice, I only practiced cardiac surgery. So I know a thing or two about the heart. I'm not a cardiologist. I'm a heart surgeon. There's a big difference. And like I said, for those 5 or 6 years, starting out in practice, I was doing triple bypasses, valve repairs, big aortic aneurysm repairs of the chest, and so on and so forth. So I did have a background close to the heart. And over a period of time, as cardiac surgery was changing and becoming more minimally invasive, which was great for the public and for patients, it wasn't so great for open heart surgeons who were still doing the big open surgeries and giving the old zipper down the sternum and all of that. And my practice was looking at other things to add to our practice to remain viable and to remain present in modern medicine. And one of the things that we found was the evolving world. Now we're going back almost 20 years, the evolving world of contemporary management of vein disease, varicose vein disease, and what we call venous insufficiency. And I segued into vein care over the course of a number of years, about another 5 years, at which point I did only vein care here in northern New Jersey, just outside of New York City, a stone's throw from the George Washington Bridge. And that expertise and experience and passion that I developed for vein care led to lymphedema care, which then led to an ever-expanding knowledge in lipedema, which is something I knew nothing about years before. And as you know very well, Brenda, we have our own podcast, the Lymphcast podcast, which features many of these same subjects. So in these last few years, I've really become immersed in it. And that's how I developed a heart for lipedema and lymphedema.
Well, we're so grateful that people like you who have a prominent voice in the medical community care. And we're so honored to have you here tonight. I know Pattie Cornute was actually on your podcast recently, which was awesome. And the questions are already starting to roll in. So I'm going to take a few, and then we're going to go around the table and talk about some other hot topics. And also, Dr. Chubak, any advice you have for our lipedema patients in general regarding their veins? But Chloe Della Costa just logged on and she asks, what level of venous insufficiency warrants vein surgery?
Well, it's a great question. The first thing is to know that you have venous insufficiency. And this whole world of venous disease, lymphedema, lipedema is very special, in my opinion, in the sense that it's still so unknown to so many primary care physicians and even specialists, vascular surgeons and so forth, who are not really aware of venous disease, and they often dismiss it. And that's something that lymphedema, lipedema, and venous disease, I think, have in common is that they're frequently dismissed as patients who are not really sick and don't really have a quote unquote real problem. So the first thing is to get in the hands of a good physician who has a knowledge of the venous system. It can be your primary care doctor, but oftentimes you'll have to see a vascular specialist who specializes in venous disease. And then what becomes most important is not so much the stage of disease that the patient has, but more importantly, how the patient feels. We don't want to treat physical findings if the patient is totally asymptomatic and feels terrific and is not at risk for complications. We don't want to treat just findings on an ultrasound that may be a good quality ultrasound, but a good quality ultrasound can find some abnormalities in many people. The most important thing to the viewer's question is, how is the patient feeling? There are patients with stage 1 and 2 disease that can be highly symptomatic. And then I can see patients with more advanced disease, 3 and 4, for example, who are relatively asymptomatic. So we always want to be taking care of the patient, listening to the patient, and treating their needs.
Excellent. And so the second part of this question involves some acronyms that people might not be familiar with in the general population. Are SEEP and VSS scores important? And are the seconds of reflux important? Can you say that in English for the rest of us that don't understand SEEP classifications or VSS scores?
Right. These are scoring systems that go into the patient's level of disease and level of symptoms. And they are important. They become important even for insurance coverage, that patients need to have certain levels of disease, certain levels of symptoms, et cetera. But from the patient's point of view, what is, again, most important is how they're feeling and how these diseases are affecting their daily life. The reflux, I joke about reflux. My father was an obstetrician and gynecologist. The reflux is almost like a pregnancy test. It's either there or it isn't. Whether you have, let's say, 1 second of reflux, 3 seconds of reflux, or 10 seconds of reflux is really immaterial. What's important is that if you have more than half of a second of reflux in the superficial venous system, it's considered abnormal. But you can find many people with abnormal reflux studies who are totally asymptomatic, have no visible varicose veins, have no skin changes, et cetera. And it would probably be inappropriate to treat those patients. On the other hand, you could have patients who are highly symptomatic, who just barely are over the reflux borderline. They might have 3/4 of a second reflux and be very symptomatic and show very significant changes in the skin and soft tissues. And that's why I sort of kid that it's like a pregnancy test. You're either pregnant or you're not. You can't be a little pregnant or a lot pregnant. The test is either positive, turns pink, or it doesn't, in the old days, of course. So it's another great question. But again, I'm a very patient-centric and patient-focused physician, which is, I think, the way most of us are trained. And you really have to look at the patient and talk to them, and especially listen to them, how they're feeling, what kind of symptoms they're having, and address everybody as an individual, mostly based on the history and the physical examination of that individual.
Excellent. We're so glad that you are so patient focused. And I do want to ask a few more questions, and note that Casey Grosvenor in chat just detailed that after her 5 lipedema removal surgeries, she went back to her vascular doctor and went through 2 days of vein surgeries to repair almost total reflux. And so what's interesting about her results, she went from averaging 12 minutes a night of deep sleep in a 6-month period to nearly an hour of deep sleep over the past 2 months. So this connection between your veins and sleep is significant.
Very common. Some of the problems with venous disease and sleep, probably the most common would be restless leg syndrome, highly associated with venous insufficiency, and leg spasms, Charlie horses, etc., which will awaken patients from sleep frequently. So that is definitely a very common story that she's telling, and one of the things that I hear most often. The other thing is, it's very good for patient awareness and for any of our physicians who are not vein specialists who are tuned in, because again, it's an area that people don't put two and two together. A patient may complain of restless leg or Charlie horses, night cramps, night spasms, and primary care physicians and non-specialists will often not know that there's an association or linkage to venous insufficiency. So therefore, the patient goes undiagnosed, untreated, and continues to suffer. And a lot of what we hear is maybe your electrolytes are out of balance, drink a little bit of Gatorade before bed, drink tonic water, which has a little bit of quinine in it before bed. So because of a lack of awareness, the patient goes misdiagnosed and then is undertreated or mistreated. So that's why programs like this are so valuable and so essential in raising that awareness.
Yeah, that's so true. I'm going to do a couple more quick questions because we knew you would be quite popular because they clamored for you, Dr. Chubak. And then I want to get to, Pattie, your recent discoveries related from our conversation last month about sciatica. Nicole Layton had varithena about 2 weeks ago for very painful varicose veins. She's still experiencing the pain and it's debilitating. She can't stand for more than 5 minutes without being in pain that gets worse the longer she stands. And our heart goes out to you, Nicole, and we feel for you greatly. She asks, am I stuck living with the pain or are there options? Now, we do not diagnose here. Obviously, you would need to get an actual medical diagnosis. So we're not asking you to go beyond the scope here, Dr. Chubak, but any thoughts about this heartbreaking question?
Yes, of course. There are several things to look at here. And of course, it's impossible for me to opine specifically on this particular situation because I haven't had the opportunity to examine the patient, review the diagnostic testing, ultrasound results, etc. But the first thing I would say is, generally speaking, in this situation, be hopeful because it's early since your treatments. So assuming that the diagnosis was made correctly and the treatment was appropriate, there is still time for healing and recovery. That's number one. And sometimes after a procedure, for full disclosure, varithena is a trade name of an FDA-approved, what we call foam injectable solution. It's basically very high-grade medical soap suds, believe it or not. We call it foam, but I like to think of it more as suds. It's really a detergent that's turned into suds, and those soap suds are injected in the vein, and they cause a chemical burn to the lining of the vein to close the vein in place of thermal ablation or heat therapy, which would cauterize the vein and heat shrink the vein. So that's a perfectly valid treatment in the right circumstance. And sometimes patients can have inflammation after the treatment, what we call phlebitis, and that can also cause pain. So again, these are just some thoughts. The one other thing that I would say, Brenda, in many cases that I see in second and third and fourth opinion here in the New York metro area is many times patients who have been properly diagnosed with venous insufficiency and are treated elsewhere. The most common problem that I see is not that the treatment that they had was inappropriate or incorrect. The most common problem that I see is that the treatment was just incomplete. So many times I'll see a patient in second or third opinion after they've been previously treated. And what I find is more untreated venous disease that just needs more therapy. And in performing those additional procedures and getting them to where they need to be, their symptoms will resolve. So that's a very common situation. The other things we have to look at, just for fullness of discussion, is some other undiagnosed problem. Could it be, as you said, you mentioned earlier, sciatica, something related to nerve pain? Can it be a neuralgia? Can it be a peripheral neuropathy? Can it be arterial disease where there's ischemia or poor blood flow to the leg? Can it be musculoskeletal, rheumatic, etc.? So there are so many things that can cause leg pain. Again, the important part for this patient to know is something is causing her pain and someone can figure it out and someone can treat her. So there's hope.
I love the message of hope. That is awesome. By the way, anybody on our panel deal with leg pain? Yeah. Yeah, it's not uncommon. Sandy Darley asks about the possible complications of GSV ablation, which for those of you who are not familiar, great saphenous vein ablation in a patient who has lipedema and lymphedema. And is ablation called for more to treat lipedema or lymphedema?
Well, again, we've got a great crowd, a lot of great questions here.
They're the best. We love them.
Yeah, I can see why. These combination of disease processes often overlap and present together. So we have venous disease, which has, as we said, very commonly great saphenous vein reflux, meaning backward flow, and that at its core is an inflammatory disease, generally inherited and an inflammatory disease. Just as people get inflammation in their joints, causing arthritis, and that can run in families, other families have this inflammatory process that affects the lining of the veins. And when the lining of the veins, called the intima, when that becomes inflamed, the very, very delicate little valves can be destroyed. And when those valves no longer function properly, then gravity pulls blood down into our leg, causing high pressure in the leg. So it's an inflammatory process. We know that lymphedema has inflammatory roots. We know that lipedema has inflammatory roots. So these inflammatory diseases that affect soft tissues, they are separate entities, but we often see them overlapping. So if you have lymphedema, for example, swelling of the legs because of insufficient lymphatic flow, which can have various causes, as we know, primary and secondary, either a congenital underdevelopment of the lymphatic system or hypoplasia, hypoplastic development, we call it, or poor function. That's one. The other would be a secondary lymphedema, where a patient may have had an injury, may have had an infection, may have had surgery, may have had lymph nodes removed. But at its core, you have an inflammatory process that leads to fluid buildup in the legs. But whenever we see lymphedema, we now know we want to check those patients for venous insufficiency as well to make sure that they don't have a very common process called phlebolymphedema. Phlebolymphedema, where the lymphatic system is really malfunctioning because the venous system is malfunctioning and the lymphatic system is being overwhelmed with too much fluid collecting in the soft tissue. And then finally, we can have, which I see very commonly in my practice, phlebolympholipedema, where a patient can have a combination of all three. And I know it's a long-winded answer, but I do want to get around to what I'm getting at, which is ultimately every aspect of the disease which is present should be treated. So if there's underlying venous disease, it needs to be treated. If there's underlying lymphedema apart from the phlebolymphedema, that needs to be addressed. And if there's lipedema, that needs to be addressed. So an excellent diagnosis needs to be made through a careful physical examination, careful history taking, again, talking to and listening to the patient, and then proper diagnostic testing. But it is much more complicated than we thought it was 10 and 20 years ago. And that's why it has really become, these have become specialties and really super subspecialties. And patients with these problems really need to seek out the best people in their area for advice and for care.
Excellent. The interconnectedness of it all is so complex and yet so important, because if you deal with just one component and ignore the others, they're impacting each other. It's a domino effect. I'm going to let you take a break, Dr. Chubak. Don't go anywhere. We have some other conversations to happen, and feel free to dive in and contribute to anything we discuss. But last month, Pattie Cornute shared her challenges with what she thought was sciatica. So you know Pattie. She will dig in and try to get answers. And so tell us what you uncovered, Pattie.
Well, the sciatica is something that I do deal with on and off. It happened when I was in my third trimester with my daughter, where I couldn't lay flat. I pretty much felt like I was being paralyzed if I laid down. So for the last trimester, I sat in a chair with my legs elevated for the whole thing. And it was a nightmare. But anyway, since then I can get, the sciatica pain in my lower back, down my leg, the whole experience. And I've gotten pretty good at being able to do movements and stretches and postures to help me relieve that. And that has since thankfully passed on. But I started to experience in the middle of the night a intense burning pain shoot across the top of my thigh, like wake me up out of a sound sleep. And, the first thing I did was I grabbed the magnesium lotion that is always on my side table, and I just massaged it into my leg. And thankfully, it started to help subside that pain. And at first, I had no clue what it was. And then it continued to happen. And it only really happened when I was sleeping. And so then I began the deep dive, and I came across something called meralgia paresthetica or
paresthetica. I wrote it down just because I knew I wasn't going to pronounce it properly. Meralgia paresthetica, which is what?
It is a nerve that runs from your lower back, and it goes through like your abdomen and your inguinals and comes out on the side of your thigh. And it's a sensory nerve, so it doesn't, get involved with muscles or anything like that, but it is for sensation. And let me tell you, when it's pinched, that pain that shoots across is just insane. So I started looking further into it and finding out what movements I could possibly do. And I did share that, I do a modified cobra pose, I do a baby cobra, and elevate that leg. And it's called nerve flossing, where you engage your head at the same time that you're kind of doing the leg movement. And thankfully, it is helping. But I'm also trying to be very mindful of when I'm noticing things hitting the side of my hips, which, we kind of struggle with that. And I looked at the traditional shape of a lipedema patient, and I'm like, why wouldn't we be prone to getting this? Because it definitely involves all the areas where this nerve runs. And I did reach out to my friend Gil Headley, who just came off of an amazing nerve tour, and I got to see that in person and learned so much more about nerves. And so it was fascinating for me to remember what he had taught us versus what I was learning. And it gave me the tools to be able to dig for the right questions and seek out some things. So that's where I'm at with that.
And if when you heard Cobra pose, you said, what's that? Go to Lipoedema Fitness. You can see the video of Pattie actually doing this in motion. And you also said that magnesium lotion has been helping you.
Yes, we tend to have some magnesium deficiencies. And so you can take it, as a supplement, but I really find the magnesium lotion you kind of want to take it to help with if you're deficient in it. But as far as the immediate relief, that lotion has been saving it's been happening for about the past 2 or 3 weeks. So wow. It's yeah.
We appreciate you sharing your journey as always.
Absolutely.
And Dr. Chubak, we often do the tips and tricks of how people are managing their conditions so they can live well and live better. And Lippy Butterfly, you held up a little bottle. What are you doing?
I tried this lymphatic support oil this past week because, as you know from us talking last month, I hadn't been able to leave the house in over a month. I hadn't been able to go to church and I hadn't been able to spend time with friends or anything like that. So I just really got frustrated with it and tired of it, and the fluctuation with my tissues getting soft and then hardening up again, which was, heartbreaking because I'm thinking that I'm getting out and I couldn't. So I decided to just throw in the towel and try these drops that I had seen on Amazon a million times, but I thought that they were kind of gimmicky when I saw them. But I decided to actually look at the ingredients, and some of the ingredients on them were things that we've talked about on this roundtable before, like burdock root and elderberry and some other things that are in here. And true enough, I've been using them for about a week, and I've had a lot of softening happening in those hard areas, and the stinging that was happening in those areas is kind of alleviating up. So I've actually had a good time with using these, and I'll continue on. I've only used them for a week now, but I'll try them out for a little bit longer and see if they actually support well. They don't taste bad either. I thought that I was going to have to dilute them in water, but and I do, but like I also just drop them down my throat because they're not bad.
Cool. That's so good to hear. And then moving over to PGP, you've been talking a lot, and this is, for someone that really does like her sweets every now and then, you've been off of sugar, and that's having a positive impact in your life. Tell all.
There's cat drama going on in the background, so sorry for the noise, but yeah, so I took advantage of like detoxing from sugar when I wasn't able to eat after having my tonsils out, and decided to switch to like sugar-free versions of the stuff that I really thought I would miss. And I don't miss sugar like I thought I would. I had one Snickers pumpkin around Halloween because I love the holiday shapes and I just think the Snickers are better as the shape. And I was in so much pain. My legs hurt. They felt tight. They were itchy. I was restless, like when it was like laying, trying to fall asleep. Like I just wanted to keep moving them. And so I told Levi, I was like, remind me of this when the Snickers Nutcrackers come out at Christmas. And I want one. Because I will be like, it's just one. But yeah, I have been, that's the only thing like that I purposely like tried that like, and I didn't watch the sugar count. Anything else, I have been avoiding like added sugar. Some things that have like a natural sugar to it, I try to keep it under 5 grams. Just because some products like I don't have the funds to like completely switch out everything. But I bake with like sugar-free chocolates now, sugar substitutes, and I'm sure there's probably like a healthier version of a substitute that even when I use, but I figured baby steps of getting
Well,
to
first of all, I think the earth just tilted on its axis a little bit because we've been doing this show for 5 years and you have never talked about any kind of modifications like
I
this.
know.
And I'm excited for you.
I was very adamant about like never really talking food other than like acknowledging that I was gluten free because of celiac disease. But I just didn't want to be one of those other like influencers that's like, I know there's lipedema and your body doesn't necessarily react to things, but have you dieted and exercised? Like, I just didn't want to push that.
No, and
But
I get
like,
it.
this to me is definitely not a diet, it's a lifestyle change because like I was noticing I like February will be 5 years post-op, my first surgery, which seems unreal. But I was noticing tightness in my legs again. I was noticing like inflammation in my face, which I thought was possibly with the whole tonsil thing. Um, but I just was noticing like pain and stuff like that again. And I was like, I noticed it after I ate something sugary. And so I was like, I should try this. And it was like months of me saying I should try this and like not really doing anything. I was waiting for Levi to be like, do it or don't talk about it. Like, that's what I was waiting for. But he just kept his mouth shut, which is probably the smartest thing.
Well, and I love what Nita Cluis just said in chat. It's all a process and we all start somewhere. And, you know, disclaimer, if you're new to the roundtable, we're talking about ideas here. What may work for one person may not work for another person. We judge nothing. We love everyone. That's the ground rule here. And then I saw you put in chat, Siouxie Boshoff, allulose for the win. Let's talk allulose. And by the way, you are a media superstar since we last got together.
Yeah, that was really exciting, actually. So, as you guys know, I'm pretty obsessed with sugar-free, and I have been for many years. And like Cara, I really have experienced that same thing. I didn't understand what it had to do with insulin and what it had to do with blood sugar, but like every time you spike your blood sugar, you're actually driving inflammation. I have lots of resources that back that up, by the way. But anyway, so obviously I love sugar-free. Allulose is an amazing sweetener because it stimulates GLP-1 naturally in the body. It stimulates your satiation hormone, satiety, leptin, and it can actually mitigate cravings. So people find that they don't binge on it like they would other sweets, even though it can satisfy that sweetness. And without getting into too much, I ended up getting interviewed by a pretty big doctor on YouTube. Her name is Dr. Boz. And it was phenomenal. It was a 1-hour interview. I got to talk about lipedema, loose connective tissue disease, little bit about Ehlers-Danlos. I was trying not to like overwhelm the audience with like a million things that they don't know what to do with. And it was amazing. She's a doctor that actually makes sure that none of her patients ever eat sweets as part of their regimen. And she also has them wear a continuous glucose monitor, which I wear. No, I'm not diabetic and I'm not pre-diabetic, but I do it so that I know how my blood sugar is reacting to things in my environment, even like low carb products that are supposed to be blood sugar friendly and 100% aren't. So stuff like that. Anyway, it was amazing. And she was like, your product's the only product that I'll let my patients have. And it was just amazing. So
what a wonderful endorsement. And thank you for, look, to create something that is healthy and not inflammatory for, especially, you know, we care mostly about the lipedema population here, but anybody who has a sugar thing. It took a lot of hard work, Siouxsie, and we honor you. And we're so glad you're getting the attention that you deserve. It's really wonderful.
Oh yeah, we sold out of like a whole bunch of product. Like we've been working on, I haven't done any Christmas shopping, just for context.
Well, for a good reason. I haven't done as much either, and I have nothing to blame for it. Dr. Chubak, you know, you are also involved in the supplement world, and I think that we should talk about that for a moment as well.
Yeah, well, I appreciate that. You know, the first disclaimer I would make is that dietary supplements in the United States are not meant to cure, diagnose, prevent, or treat any diseases. So that is the first thing I'd say right off of the bat. But that being said, the main ingredient in our main body of supplements, micronized purified flavonoid fraction, known as MPFF, has been studied extensively for the last 40 years in Europe and in the United States with some really powerful randomized controlled studies and meta-analyses and things like that. And Dr. Monica Glavitsky, who I think may be tuned in this evening and listening, she's our chief clinical and scientific advisor. Monica is an MD, PhD, brilliant woman, did about 15 years of research in Paris on MPFF, looking at its role in the lymphatic and venous system. And there's no question, based on those studies, that these flavonoids support the venous and lymphatic systems, and clearly support lymphatic flow and normal venous function. And so, for people listening to this program, it's something that I would strongly suggest you look at and do your own research. I'm not here to pitch anything. That's not obviously not the purpose of my visit on today's show. But look at micronized purified flavonoid fraction. Look at our products. Look at the science independently, and make your own decision. We're never looking for followers. We don't have any movement to join, but we're always looking for students. And I think that you guys are a great group of students from what I hear and what I see you all talking about.
And we're on the edges of our seats because we still have so much to learn. And here's some more questions we're going to just throw at you. And we love that you just handle whatever we throw at you. So anonymous attendee wants to know, should we or should we not take collagen? Confused.
Oh, this is a great question. I am going to plead to some degree ignorance. I don't want to make believe that I have expertise in that particular subject, but I would say again, I think you should look at it. Look at the research for your own particular problem. I think I have some personal skepticism that additional collagen might go to your soft tissues and repair them when you have soft tissue issues and fat disorders and things like that. But again, I want to be clear, I don't have expertise on collagen, so I can't give you a really well-informed answer. But it's a great question. It really is.
So about phlebitis, is this a common side effect after a vein ablation? Amanda Hadaway wants to know.
Yes, and I want to apologize to our previous questioner. I think I didn't fully answer her question about complications of GSV ablation. So these two questions go together beautifully. Phlebitis simply means phleb refers to vein, and itis is inflammation. So inflammation of the vein. And there are many causes of phlebitis. And there's superficial phlebitis, and there can be deep system phlebitis. And as a result of most treatments, basically as a result of all treatments, you are intentionally, the physician is intentionally creating phlebitis to basically destroy the vein and have the vein eventually get absorbed by the body and disappear. So, for example, many of your listeners will be familiar with the term sclerotherapy. Sclerotherapy that we use to treat veins of various sizes, everything from tiny little spider veins that we call telangiectasia, all the way to the big veins like the great saphenous vein. We are creating, sclero means scarring, therapy means treatment. So you're scarring away the vein by causing inflammation in it, whether it's using heat, like thermal injury with a laser or radio frequency, or chemical ablation or pharmaceutical ablation with things like injectables, like soap suds, saline solution, hypertonic saline, etc. So either way, you're causing phlebitis as a treatment in that case, but it's well controlled and well understood. And to the other question about great saphenous complications after treatment, the biggest thing we worry about is deep vein thrombosis as a complication, DVT, where the great saphenous vein is a superficial vein, but it joins the deep system in the groin at the femoral vein. That's called the saphenal-femoral junction. It also joins the deep system throughout the length of the vein, all the way from the ankle to the groin through what we call perforating veins that connect the superficial system to the deep system of veins through the muscles, through connecting veins. So blood clots can form in the deep system after great saphenous ablation or closure procedures. So that's one of the complications. Phlebitis is one of the complications. It's typically self-limited and will get better with warm compresses, non-steroidal anti-inflammatory drugs like ibuprofen, compression therapy, exercise, stretching, and of course, the best medicine, tincture of time. Those things will heal on their own. So these are all great questions and kind of overlapped and mixed into each other. I'll just say one more thing about phlebitis. Phlebitis, when not caused by the doctor intentionally through treatment, which is what we call iatrogenic cause, meaning the doctor caused it intentionally or caused by the therapy, phlebitis is often a complication of varicose veins and venous insufficiency, because when the blood is pooling in these inflamed veins and there's very poor blood flow, you get stagnant flow, blood pooling, just sitting, and often it will clot off spontaneously. And that clotting effect inside of the vein causes an inflammatory process, so the veins can be hot, tender to the touch, red, etc. And that should be evaluated by a doctor. And one thing I will say that we've learned in recent years, this wasn't known before, phlebitis was always seen, superficial phlebitis was seen as a very benign problem that you didn't have to worry about. We now know that when people present with superficial phlebitis, about 30% of those people will also have a DVT. So it's very important that they go and get a venous ultrasound. And one other interesting thing about those studies that have been shown, the DVT is just as likely to be in the opposite leg than the leg with the phlebitis, because it's not always a direct extension of the blood clot into the deep system. What happens is that clotting process sets up an inflammatory pro-clotting process in the whole body. So you're just as likely to get it in the opposite leg. So it's a very, very interesting subject. But if you ever have phlebitis, be seen by your doctor and make sure he gets you an ultrasound, because he or she may not be aware how important that is with superficial phlebitis.
That's so valuable to just know to ask for that. This is like a master class. And I'm sorry that I sort of dozed through science and physiology in school, because I'm really learning a lot tonight. And I thank you for your expertise and making everything so understandable. I'm going to do some rapid fire questions. And then, we try to do a little warm and fuzzy here every month too, to let everybody feel the love. So what would be the gift you would give the lipedema community this year for the holiday season? I want everybody to be thinking about that. But what are your thoughts, Dr. Chubak? Lori Peldnitz wants to know on Diosmin vasculara for vein health, and I hope I pronounced that properly.
Yes. Diosmin is a bioflavonoid, and it is one of the ingredients in our MPFF-based supplements. MPFF, again, stands for micronized purified flavonoid fraction. So diosmin is one flavonoid, and it has been shown to have positive effects on the venous and lymphatic system, whereas our products, Vein Formula and Lymphatic Formula from VitaSupport MD, they have a combination of 5 flavonoids, which have been shown to be more effective because you're getting 5 flavonoids as opposed to 1, and also micronized for better absorption. So the simple answer is that diosmin has been shown in many studies to be effective in helping the venous and lymphatic system to function. But many studies have been done comparing MPFF to diosmin and have shown clearly to be superior to diosmin alone. So it's another great question. I'm so impressed with the group.
I know they're so smart, way smarter than the moderator, that's for sure. And I love seeing new names out there like Melissa Klotka. Thank you for being here tonight. We appreciate you logging on. Every month is different. The chatters will tell you. Some nights we are very intensely medical. Some nights we are very social butterflies, like the lippy butterfly is our butterfly representative. Tonight is very medically focused. And by the way, Jenny Bogine, you haven't said anything yet tonight because you haven't had a chance, but I just want you to know you are rocking those reindeer ears beautifully.
You know, we all have to have up months and down months, and hey, I got the ears, you know.
Love it. And we love how you help navigate chat because sometimes I'm too busy to respond to everyone. So Melissa Klocka asks, can lipedema somehow cause nighttime issues with tachycardia or night tremors? Would that be any side effect of venous or some other lippy issue?
You know, it's a great question. I think that the answer is potentially yes. In fact, it wasn't long ago I was watching a lecture by Dr. Karen Herbst, who you know very well. And Karen was talking about Derkham's disease and the inflammatory process of Derkham's disease. And one of the things she talked about was palpitations, cardiac arrhythmias, et cetera, if I'm not mistaken. So I would say that certainly, yes, it's a real possibility because of the inflammatory process that's going on, and something to look at. Certainly, whenever, again, I can say this with great confidence as a cardiac surgeon, when anybody has palpitations or what we call arrhythmias, that they can feel a fluttering in the chest, this sensation that someone's kind of kicking them inside of their chest, an irregular or abnormal heart rhythm, they should definitely be seen by a cardiologist for a full workup at any age. I think it's very important. That being said, I can tell you oftentimes, many times, it's completely benign and not dangerous, but it needs to be worked up to make sure that that's the case. And it's very easy to do with cardiac testing, a Holter monitor, EKG, stress test. But if there are any palpitations happening, please see a cardiologist for a full evaluation.
Excellent. Good advice. And we got a private message from Francine Schwartz wishing us love and good health as her gift wish to all of us. And drop your wishes in the chat so we can read them and be encouraged. I cannot believe that we are coming into the last 10 minutes of this program. I love the discussion and people are really appreciating your wisdom, Dr. Chubak. Thank you so much. So gifts that you would grant to the lipedema community. Susie, what would you offer?
That's so funny. The gift that I would give is the gift of loving yourself and finding yourself worthy enough to cut out any assholes in your world. You know, I'm ruthless about that. And I had to drop one word. I'm so sorry, Brenda, before the end, because I'm the spicy one.
We need the spice.
Yeah.
And everybody is saying 100%. Yes, we agree. Knowing, you know, we teach people how to love us by the way we love ourselves. And so the quality of love that's coming to you, I often say, Brenda, look at how you're loving yourself because that's what you're going to attract. And so thank you. That is such good wisdom. I also want to say we're sending lots of love to two dear friends. First of all, April Sluter is in the audience tonight, and we treasure you and we thank you. We're so glad you're here tonight. Susan O'Hara, Powerhouse, is in the audience tonight. So many wonderful friends. You are gifts to us. You are gifts to the lipedema community. Jenny Bogine, what gift would you give? And you dropped some wisdom on me before we went live, so I want you to give that as well.
Well, yeah, I was just gonna say I have two things. So today, up here in New England, we have a group called Boston Area Fatties, and it's a body positivity group, and they're lovely. It's a lovely group. One of the members today had a column that was picked up by HuffPost, which has 58 million readers, but it's called, and this is my gift. Her name is Janelle Testa, and she wrote about, this is how I'm navigating the holidays while being unapologetically body positive. And it's a little bit of a different spin on it because she comes from a place of eating disorders that she's managed to overcome mountains on, but it's a great read. So I think if you looked up Janelle, Ginelle, Testa, it dropped today. And it was a great read about dealing with families at the holidays who may be well-meaning, but totally causing grief and problems for those of us, in a very, stupid way. But anyhow, the other thing is that I read in another group, Lipoedema group this month, and it's a mantra that I always try to live by, to remember that we're so much more than just our lipedema. I think we get caught up in it, and in doing all this work and being on the social media and getting the awareness out, sometimes you kind of forget that when you're with your family, with your friends, just out in the world at the grocery store, people aren't obsessed with your lipedema. We're so much more than that, and our lives are so much fuller than that. And to remember that, especially at this time of year.
Beautiful reminder. Thank you so much, Jenny. Appreciate you.
Mm-hmm.
Pattie Cornute.
Oh, I think the gift is everybody coming together. I mean, being able to share and have a medical professional like Dr. Chubak here and hearing our questions, and that's going to enrich his life as well as our lives. And it's how we're going to find answers and hope. And I loved what you had to say about that, doctor. And so just remember, there's always going to be hope.
As long as there are very smart people who care, like Dr. Chubak and Dr. Herbst and so many others, there is hope. There is always hope. Pale Ginger Pear, what gift would you like to give?
I think it would be like a guilt-free holiday of taking care of yourself. Like, don't feel that you have to do every holiday event and tradition just because you've done it in the past. If you need that additional hour to sit down, sit down. They can either join you in the room you're sitting in, or like that's their problem. But don't feel guilty about it.
Guilt-free zone. I love it. That's a perfect thing to say. So, Lippy Butterfly. Oh, Lippy, we usually ask you to sing for us, and I didn't organize that in advance.
Okay, we'll do something maybe in the new year then. But
We would
I
love
would
that.
give out peace that surpasses understanding in this season. No matter what you're going through, whether you're like having struggles with family, whether your body is giving you issues or whatever, that you would just have peace to make it through these holidays. I mean, some of us, we've experienced loss and loss of loved ones, and the holidays are kind of hard, but I would just wish peace for everyone.
That's a beautiful wish. Peace on earth. Yes. And in our hearts, surpassing our understanding. Dr. Chubak, what would you like to give as a gift if you could do anything in the world for the lipedema community? What would it be? What would be your wish?
My gift to them would be the gift of self-compassion, to be more compassionate with ourselves, all of us, with and without lipedema, because none of us is perfect, and none of us sees ourselves as perfect. And Dr. Chubak is just as guilty of that sin as anybody else. When I look in the mirror, I judge myself and so on and so forth. I think we all need to be more compassionate with ourselves. And then, as Lippy Butterfly said, more compassionate and loving and kind toward others as well. So I think the world could use some more kindness.
What the world needs now. Come on, everybody, is love, sweet love. I know Pale Ginger Pear saying, no, we're not going there, Brenda. And so I do want to thank Dr. Chubak for his wisdom. And I also know that he is a fan of Lympha Press. And I want to thank Lympha Press for being here. I would wish for everyone that they could have the best pneumatic compression therapy available to them. I hope you all feel seen and heard and loved tonight, because you surely are. We thank you all for joining us. Happy holidays and Happy New Year. We'll see you in January.